My knee isn't going straight after a knee replacement. So what I need is long duration, low intensity, so kind of a gentle, long, slow stretch to try and stimulate that stretch response, to allow those connective tissues, the scar tissue, the ligament, the tendon, to lengthen. We're not so much talking about muscular lengthening. We're talking about connective tissue in the form of joint capsule, ligament, tendon, scar tissue. We understand from a neurologic approach that when something presses against our body's natural response is to press back. When a therapist, when a brace, when anything presses down against the knee's response is to tighten and fight that and press back. So what I find to be a little more effective is a form of traction to gain extension. And one way you can do it is with these bands. Now, there's different names for them. These are not TheraBands. They're not the flat band. They're not the tubing. Some people call these monster bands, pull-up bands. So they're about 15 to 20 bucks. They're very tense, but they do have some stretch to them. And the way I typically advise my patient to use it, so imagine this is my hallway, this is a closet door. What we would typically do is wrap it around the closet door. In this case, I'm going to double it up just to make it a little bit shorter. You can keep yours full length to give you a little more stretch. I'm going to put my foot into the loop. And so pretend that there's a knee contracture. Pretend that I can't get it totally straight. All I do first is I just sit back and relax. From this position, I can do a little bit of a rocking motion. So my muscles, my nervous system, everything is working on getting the extension. If you notice the line of pull, it's not pushing my knee down, it's pulling my foot forward. And that tends to be a little less responsive to the nervous system. My body doesn't want to protect as much. And then I'll slide the chair back, scoot my bottom back, and then just kind of sit here. Now in this position, I could be watching TV, depending on where we are. I could be reading a book, checking my phone. But I've got a little bit of this kind of bouncing oscillation. I've got traction pulling through the knee. I'm separating the joint surfaces just a little bit. There should not be anything that's going to increase my swelling. This won't reduce swelling, but it shouldn't increase the swelling. And so the idea behind improving that knee extension is if you imagine this bottom bone and this top bone coming together to form the knee joint, if somebody pushes down, your body is going to react by contracting, by tightening. If something hurts, what happens? You get tense. If I poke you in the stomach, what do? Tighten up. And then you giggle. Just kidding. But the idea is that we want these bones to be pulled apart so that they will drop down into extension and we can create some space. So this is one of my favorite ways. If I've got a patient who's at home, they're just struggling to get that last little bit of, 5 degrees of extension. We get them set up here. And then, like I said, if that's too high and you can't get it doubled up, you just put it in like this. You just have to be able to scoot back further. This is a much more gentle way to do it. If I use a thicker band, certainly same thing. I get it in here. I'm back, I'm relaxed. I can do a little bounce, a little oscillation. I can work on a version of a heel slide. This is just like a heel slide. But the idea is when I tighten the muscles in the back of the knee, it will reflexively relax the muscles on the front. So let's think about this for a second. Our bodies are designed to work in opposites. When my brain tells this muscle to tighten, my brain reflexively tells this muscle to relax. They both can't be tight at the same time. So when I'm sitting here and I tell my hamstring, the muscles behind my leg, to tighten, to pull this back to me, reflexively, this muscle will turn off. And then I come back in and I can relax a little bit, and then I tighten it and I relax. This is a technique called contract relax. There's just so many different ways to do it, but the goal is we want to stay back so that there's that traction force pulling forward on the knee. I would hang out here 5 minutes initially, 7 minutes, 10 minutes, probably up to 15 to 20 minutes if I could tolerate it in this position. If that was just too aggressive, no worries, bring it here. I'll be off camera, but I would just back up so that there's still that traction force, but maybe my foot can remain supported right on the ground or close to it. So I hope that helps. Nothing fancy. This is one of my favorites that's worked really well over the years.